Hello everyone. This video is the first of a series of micro lectures related to our weekly topics for this course. Don't worry, it's not going to be too long, hence the term micro lecture. But my hope is to bring in some real-world applicability to our exploration of the weekly topics, and I will try to keep it focused and to the point, but there is definitely a lot to get through, so I will just jump right in. What I'd like to start with is an exploration of what foundational knowledge you'll need in order to understand what we're going to talk about in this particular video. Most of this is going to be covered in your text or in the other required readings, but I want to make sure we are all starting on the same foot. So for this particular lecture, we need to understand what is policy. So this could be any kind of policy. It does not have to be specific to healthcare or health or anything related to healthcare administration, but just what is policy in general. So the definition that I like to work with is from the CDC, and it is a law, regulation, procedure, administrative action, incentive, or voluntary practice of governments and other institutions. And that is a lot of a lot of words to basically say it is anything that we all agree on we're going to use public resources in order to execute. Okay, so that's really what a policy is, and this can be an economic policy, it can be a public health policy, it can be all kinds of different types of policies, but that's the basic definition of a policy. Also from your reading, which hopefully you have done or are preparing to, you are familiar with the determinants of health, which are factors that influence the health of an individual or of a group. That can be things like behaviors, socioeconomic status, demographics. Your text gives a whole list of determinants of health that I would really encourage you to review prior to continuing with this lecture. Also important to understand what is the role of public health, because that's, even though we talk about a lot of different healthcare and health entities in this course, a lot of it is going to be related to public health, just because that is sort of the nature of healthcare policy, and it is fairly inextricably linked to systems thinking, which is a major component of this course. So just to have a working understanding of what public health is, it is the purpose of it is to protect lives and improve health of populations. And that can be very, very specific populations, or it can be just the general health of an entire country or an entire community, or global health as well. It is also part of public health. And then we need to define health itself, right? And in this course and in most public health or healthcare administration courses, the WHO definition of health is what we are working with, which is not just the absence of disease or infirmity, but complete physical, mental, and social well-being. So it's a very broad, overarching definition that most professionals in the field would use, and definitely in healthcare administration courses and public health courses as well. So if you're unfamiliar with any of the terms or theories on this slide, I would recommend pausing, reviewing those, making sure you have a fairly good understanding of that, of those concepts before moving forward, because like I said, I'm not, this is a micro lecture, so I'm not going to get into all the nitty gritty of the things we are exploring in our readings and our viewings for this module, but I'm going to really try to keep it focused. So as promised, this is how focused it's going to be. I'm really only talking about two very specific things. I'm giving kind of an overview of what health policy specifically is, and then the value of health policy to health administrators, and that's going to extend to all leaders in the healthcare and health world, okay? All right, so what is health policy? And this is a definition from your text. And you might notice that it is far less expansive than our general definition of policy. It's very, very specific to the attainment of health. So it is just policy that relates to or influences the attainment of health. So it's a very, very narrow definition. And that is what we are working with. And this seems very, very simple, I think. When you look at it, you're like, yeah, of course, that's what it is, right? It's right there in the name. We know what policy is. Health policy would be specific to health, right? But there are some ways that this can get confusing in actual practice. And the way that I see most often is because we do not always differentiate healthcare and health. In fact, you could see a couple slides ago, I said health administrators and healthcare leaders. We kind of use these terms interchangeably a lot in the field. And sometimes that's perfectly acceptable. It's shorthand, it makes sense. We all know what we're talking about, right? But when we're specifically focused on health policy, it is important that we differentiate these two. So healthcare policy and health policy are two very different things. Healthcare policy is going to be very specific to like delivery, organizing, licensing, policy that's going to really impact the delivery of healthcare in a very practical sense. So that's what healthcare policy is. It's going to be about the actual delivery of healthcare services. And it's usually going to be related to something like financing, licensing, reimbursement rules related to that, right? Health policy is going to be a much broader subject, and it's going to be related to population health, health equity, health quality, and access. So these are going to be two sides of the same coin. Yes, they're very much interrelated and they work together, but it's important that we're able to differentiate them as well. Health policy is really going to emphasize that population view, that systems view, okay? So that is what's important to understand from this specific term. And then we kind of want to explore what the determinants of health policy are. So what does that mean? Kind of written right there in the name. And this is another kind of buzzword that we use a lot in healthcare administration and public health are determinants of health, right? We just talked about it on the very first slide. But when we are talking about health policy determinants, we are really talking about what influences the passage of these specific policies. Why do specific policies get passed, get support, and get ultimately implemented, right? So what causes that to happen? Because spoiler alert, it's not always what's best for the population. It's not always the optimal solution to a specific problem, right? There's a lot of things that actually influence health policy that are unrelated to scientific research or what's actually going to affect the most change. So there's a lot of different things that actually come into play when we're talking about health policy. So we're looking at broad determinants, so those overarching factors that really impact at a system level. The first one's really just the magnitude and severity of the health problem. How serious is it? Okay, and we saw that a lot with the pandemic. This was a major worldwide global problem, extremely severe, right? And so that's going to impact how readily it's addressed and how, not necessarily effectively, but how efficiently leaderships, governments, groups are willing to act. So that is one of the determinants of how health policy is passed. Another would be sociocultural norms. This is our values, our beliefs, our attitudes, the way people think about a health problem. And this is one of the biggest things that impact health policy because it is extremely fickle, right? It is not often linked directly and perfectly to scientific reality or medical reality. It is often very, very complex, just like with any other subject, values, beliefs, attitudes, behaviors. have a whole host of different influences that can impact how they present themselves in the world, right? The same goes for when we're talking about health policy. Sociocultural norms are really going to influence how much a population is willing to manage, deal with, or create policy in order to address a specific problem. And you don't really have to look any further than any pandemic that we've dealt with, but especially if we're looking at HIV/AIDS epidemic, and obviously anything that's required a vaccine. There's going to be a lot of values, beliefs, attitudes that impact that might not directly be supported by research or medical knowledge or prevailing, reason within the scientific community. Additionally, the type of political system also has a huge impact on what health policy is passed and how quickly it is passed. Now, we see in our text, they talk about authoritarian and democratic political systems. Obviously, there's a whole host of different kinds of political systems and systems that call themselves democratic that are not democratic. But when we're breaking these down to what it actually means, democratic is going to be something that's very much ruled by the people, very much supported and driven by what popular opinion is and what the values of the population are. Authoritarian is going to be a much smaller group or one person making decisions for a large group. And each of these different systems have different benefits, actually. You might, of course, in American society say, of course, the democratic process is going to be the best for public health policy or any kind of health policy. And you could very well be right. But if we're talking about expediency, we want to have something implemented very, very quickly. Authoritarian governments or political systems are much more likely to pass health policy very, very quickly because they don't have to consult anybody, right? They can just pass it. Now, the drawback from that is that those policies are not necessarily linked to what is best for the population or what will work for the population or what the population even wants, right? So there are certain drawbacks to that as well. And the opposite is true for democratically led political systems. You might end up with a policy that really pleases the people, that really works for them, or really reflects their values and what they're wanting for their own health, but it might take a much longer time to get there, and it might be a much harder road to get to a policy that's actually able to be implemented. And once you get there, it might have been very, very watered down from the original intent because we have so many different opinions playing a role in that policy creation. All right, narrow determinants is going to be the opposite of broad determinants, right? So it's going to be the much more specific things that we look at that influence the creation of health policy. First one is solutions, okay? So there might be multiple solutions to a specific health problem. We looked in the previous slide at, magnitude and severity of a problem really impacts the creation of health policy. The solutions also impact it, right? Because there might be an ideal, optimal, perfect solution, but it's very, very expensive. Or the political climate doesn't support that specific solution, or it doesn't meet the expectations of the people in the community who want something far simpler or that reflects their values better. So that can really influence what policy is put into place or is created or proposed because it has to reflect not only the needs of the population, but also the preferences and the political climate, and also what resources are going to be utilized. So there's the solutions themselves can be part of what policy is going to be created or implemented or passed. Stakeholders are going to be another determinant of health policy. So that's going to be anyone who's got any direct or even indirect role in developing that policy. So it could be who is who's actually writing the policy, who's proposing it, who's doing the research for it, or it can be much more indirect, such as the people being surveyed about that policy, the people who could possibly vote or maybe will not vote about that policy. There are a lot of different stakeholders when we're talking about health policy, and it gets more complicated depending on the level. Something that's very, very local could be much more complex than even a national policy, depending on the different stakeholders at play in that community. Leadership is another determinant of health policy. And this generally is going to refer to government body leaders. So this is going to be the people who, and that could be everything from the president to the city council leader or chairperson. And it's going to really be reflected in how well they are supporting that policy, how well they are advocating for that policy, how much it means to them, and if it is in their political interest to pass such a policy or to support that policy's passage. And finally, resources. This is the inconvenient reality of health policy, is even the best policy has all the support in the world, all the stakeholders are on board, it's the optimal solution, government really likes it, even that can fall apart if we don't have the financial or the administrative power to get it passed or to get it implemented. Resources are finite, even in a massive country like the United States, but even more so in much smaller communities or at the local level. So if the resources aren't there, they just aren't there. And that is unfortunately going to impact the passage of health policy, regardless of the quality of that policy. So those are kind of the main things that I want to make sure we understand about what health policy is and what determines what health policies are proposed, passed, and implemented. It's also important that we talk about, and this is kind of the point of these little micro lectures, why should you care, right? What does this matter to you? You might have nothing to do with policy in your careers. It might not be something you even care about. Maybe you're going to go on to clinical practice. Maybe you have a very niche interest in a specific part of healthcare leadership or healthcare world. You're only interested in management, whatever it is. Why should you care? And that's really the $10 million question, right? The really important thing to understand about health policy is that it is something that impacts all of healthcare, regardless, particularly if you are in a position of any kind of authority. It's going to govern how you practice, even in a clinical setting. It is going to play a role in the health of your population that you are serving. And it even is going to influence other determinants of health that can impact the health of the population or the community that you're working with. It can put barriers in place that can prevent people from accessing care. It can prevent equitable care. It can prevent quality of care. And these are things that, regardless of what role you're playing in the healthcare world or the public health realm, you have to be concerned about, because they don't just impact, oh, this policy is going to affect this group in my community. Anything that's going to impact quality, access, or the health of a population is ultimately, and I hate to bring it down to brass tacks, but it is ultimately going to impact the longevity of your organization. It's going to impact reimbursement. It's going to impact outcomes. And it's going to have a lot of extremely practical and financial implications for any healthcare organization that's serving any portion of the population. Also, understanding health policy allows you as a stakeholder, because you are, even if you think I only want to be a CFO of X hospital, it's still going to impact you. You're still a stakeholder in public policy or in health policy. But understanding that policy and how it impacts you and how it impacts the population that you serve is going to be the way that you can help facilitate change, that you can support the right policies, that you can propose the right policies, and that you can act to make appropriate changes that are going to better serve you, your population, and the organization that you are working for. So it has practical applications beyond just we want to have good policy as a nation or as a community, or we want to see positive changes in public health. It has real practical applications to even on the organization level, even in very, very narrow scope of practice, even at the clinical provider level. Health policy impacts those roles, and you are a stakeholder, whether you know it or not. So that is kind of our impetus for understanding, learning about, and really getting invested in what health policy is. So that is what I wanted to explore with this. See, I promised you it was going to be short, not too terribly long. That's what I wanted to explore with this lecture. We are going to obviously be talking about health policy for the duration of this course, and fairly in-depth in this module. If you do have questions or concerns, there's things that just aren't making sense, I would recommend posting in the class question board, or you can bring me your questions directly. We can talk through some of these issues together. It'll also be material that we are exploring in our discussions and also in our journal article reviews. So this topic is not going anywhere, basically what I want to say. But that's all that I have for you now. If you have questions, concerns, feel free to reach out, or again, post in that class question board. Thank you. Bye-bye.